We have to close it on the sure.
Good morning, and welcome to this momentous occasion. We at Jahmale Medical Solutions are thrilled to celebrate a new era in medical diagnostics, one that promises to bring advanced care and hope to our community. We are here today to inaugurate the Luminous Impulse, the latest in Siemens fluoroscopy technology. Many of you may be familiar with the term X-ray, and in essence, fluoroscopy is a powerful and dynamic evolution of that very same principle. While a standard X-ray gives us a single static image, fluoroscopy allows us to see what's happening in motion. It's a real-time, moving picture of your internal structures captured with incredibly precise X-ray technology and displayed on a monitor for our physicians. This remarkable capability is achieved with a radiation dose that is actually lower than many standard X-ray examinations. So, what does this mean for us? It means we can now visualize the intricate workings of the body's most vital systems with unparalleled clarity. We can closely examine the gastrointestinal tract, the esophagus, stomach, and colon as it functions. We can observe the urinary tract, the kidneys, ureters, bladder, and urethra. And importantly, we can now offer a deeper insight into the reproductive tract, including the uterus and fallopian tubes. This advancement is a critical tool for infertility workup, a significant public health challenge both here in Liberia and around the world. The Luminous Impulse empowers our doctors to provide better diagnoses and more effective treatment plans. With this new technology, we can perform some of the most important fluoroscopic procedures with greater precision than ever before. Procedures like barium swallows to study the esophagus, hysterosalpingography to examine the uterus and fallopian tubes, and barium meals for the stomach all become more detailed and insightful. To achieve this, we use a specialized X-ray setup in combination with safe contrast media, like barium for swallowing or drinking, and iodine-based contrast agents like gastrographin and urographin. Our commitment to safety is paramount. We have invested in the most comprehensive protective equipment available, including lead aprons, gloves, gonad shields, thyroid shields, and eye goggles, to ensure the well-being of both our patients and our dedicated medical professionals. We at Jahmale, thank you for joining us on this incredible journey. The future of healthcare starts now.
Thank you. Well, let's get
So in simple terms, it's a super duper X-ray machine,
Definitely. Yes.
basically,
Yes.
but way another level,
Yeah.
active, like it said, real time. It's watching everything that's happening.
Yes.
Wow. Have you tried anybody?
Yes.
Go there.
Dr. Woodman has done it himself. He was a patient on the Tesla.
And you're going to be handling this.
Yes. With
Well, of course.
Can we ask a few questions?
Sure, please.
yes, sir.
Doc, what's the difference between this and the MRI? And
Oh.
also the CT? Even though we have heard it is an advanced one,
Okay.
but what does the MRI do? What does the CT scan do? And what does this one do different?
Okay, so
The mic said.
Oh. That's not good?
okay, there are differences actually. Basically, we divide them into two. Okay, radiation producing machines and magnet producing machines. MRI actually uses a magnet to produce image, not radiation. Okay, this one is a fluoroscopy is a type of X-ray, somehow advanced than standard X-ray, and somehow lower than CT scan. Okay, So they are completely different, but regarding the advantages, what they do, it depends upon the indication, okay? There are some aspects where fluoroscopy or CT scan or X-ray is stronger than MRI, and there are other issues also. MRI is stronger than X-ray, fluoroscopy, and CT scan, so they complement each other.
They complement.
Yes.
Now, what do you say about the radiation? You know, most people are afraid of doing these things because they don't want something
Okay.
happening in there because of the radiation. What do you say about that?
Okay, actually, fluoroscopy has the lowest radiation than CT scan and standard X-ray. Standard X-ray.
Yeah, you did say that.
Yes, because the imaging technique is continuous. Unlike X-ray, in X-ray, what we do is it's just a shot. Okay, take a static image and then produce an image and then we interpret it. But fluoroscopy, we extend the exposure because it shows a moving picture of the X-ray. So because it's somehow longer than the standard X-ray, the dose of the radiation is very low. It's very minimal, but in addition to that, we have also protective mechanisms, okay? So there are things we call aprons, okay? Lid covered coverings. We can see them. This one are lid shields, okay? So this one is about 3.5 millimeter thick lid shield, thicker lid shield. Inside is a cloth, outside is a cloth. Inside there is a lid. So it protects the most important vital organs. For example, if we are imaging the chest, we cover the reproductive organ with this. Okay. We also cover the thyroid. For example, this one is called thyroid because the thyroid is supposed to be one of the sensitive organs. So we cover it like this. So it protects the thyroid, and we use eye goggles as well to protect the eye. Okay. So. If we are not imaging the head, for example, if we are imaging other parts of the body other than the head, we have to cover the eyes and the thyroid. So put it like this. This is also a lid shield. The other thing is we have also lid gloves. Okay? So we wear it like this.
For the patient.
Yes, for the patient sometimes, for the professional as well.
Okay. Now, everybody in this country knows that Germany has professional equipment, but do you have the expertise to operate these machines?
Well, yeah, we have the experts actually to operate the existing standards.
Do you have a plan for training to increase manpower?
This
Well,
question
it's always the plan of the management. That's the whole idea. Everything we do is for training. So we have to have, as you know, we have a lot of young people going out for training as we speak, all over the place. The one thing that we don't have in Liberia is a lot of specialists. And so now we're training them in preparation. In the meantime, we have to get the professionals to come in here. As you can see, the types of machines that are here is not a trial and error thing.
No.
Right. And then in the process, everybody's being trained on it to eventually be able to handle it.
So
The whole idea of this place is for eventually to be fully Liberian managed. But until then, we have to keep it going and get the training from wherever we can get the training.
Just one more question from my end.
Let me get
One more from my end. I'll come to you. Mr. Board Chairman, what does this mean for Liberia? We know that people spend a lot of money traveling from this country, taking risks, going out of the country. If you have to travel to Ghana, you must carry somebody with you for this kind of a test. You spend money, you're taking risks in the plane. I don't like planes. I'm afraid of planes.
So how do you travel?
Well, I don't even like to, I've been around 17 times, I don't want to go again. But the point is, what does this mean for the Liberian people who are watching today and listening? Does it mean that we're going to be cutting down expenses, cutting down risks?
Well, you see, this was the whole purpose of Jahmale being established. So that the things that the citizens had to leave the country for, we try to make it here, local. But this is what it's going to do. You don't have to leave the country to come and do these things.
No.
I remember somewhere 2005, 2006, when we didn't even have a CT scan in the entire country.
Yeah.
And you know, with what we do at NASCOR, the employment injury, anybody who come and tell you I fell off the motorbike and cracked my skull, and there was no way to prove it. So we then again had to pick you up, send you out of here to Ghana to do a CT scan.
CT scan, yeah.
Now you have Jahmale here with a CT scan, an MRI,
And then
the
this,
fluoroscopic machine. Nobody needs to go anywhere. And this is why you have a first-class diagnostic center here for all Liberians to use.
So, DG, what is the plan look like in terms of expansion in other part of Liberia?
you mean
Other
this
parts. Well, let's try to get this one in this part first, and then we'll go into other parts, yeah? Let's try to get this expanded a little bit and then, and get it properly situated, and then we can think of that.
Okay, excuse me, DJ, just to let you guys know, this room was the holding room before. It has been transformed into the fluoroscopic room, but we do have the holding room, the multi-purpose holding room that we all would like you to take a tour
Now, when you
of.
say hold the room, please explain.
I will explain when we get on that side.
Oh.
Well, okay, I can do it here. Okay, the holding room, multi-purpose holding room, is a room set aside for our patients that come in to do testing. And say a patient came in, but the MRI machine is in use. We don't want the patient sitting and maybe they're on stretcher, so we bring them into this room and they are well kept here comfortably until it's time for them to go. Another thing, the holding room, they have multi-purpose holding room will be used for patients coming in. Sometimes they have very high blood pressure. We have to stabilize them before they can be transferred to another facility, with inpatient. So that is the purpose of the holding room. Also, that holding room, we do treatment. Say if an accident happened and they brought in the patient, we are able to treat them right there. It's a beautiful room, comfortable. Also, lastly, the holding room is used for our ambulance patients. Mostly, they come on stretcher, and they have sometimes the ambulance is called to go back.
Is it
And
the
that-
same as ICU?
No, it's not ICU.
Oh, okay.
ICU is intensive care unit.
Yeah.
This is just a holding room designed to keep our patients stable until the transportation is, available to take them. Sometimes the family leave them or the ambulance have to go back, so they are in that holding room, but they are comfortable until they come back.
If
for
I would
them.
like to know your name, please.
My name is Mrs. Collins, Rita Collins.
Okay, and the title?
I'm the clinical administrator here at Jahmale.
All right.
Okay, so now at this time, we will take a tour of the holding room,
Right.
the newly built holding room.
Let us see. Thank you. Okay, we're going to another. Taking a tour of the holding room.
Yeah, the assistant said. So this is the ambulance entrance.
Oh.
Yeah, so the ambulance comes through here. With the patient.
So the ambulance will come to this side.
Yes, the ambulance
That's
comes.
emergency.
Yes.
All right.
This is the ambulance entrance, where they come and they go in there. But as I said, maybe the fluoroscopy machine might have a patient, and that ambulance brought a patient for fluoroscope. So they will keep them in here until that machine is available. Yeah. So you won't have to be waiting. So at this time, we invite our chairman again
Okay.
to cut the ribbon to our multi-purpose holding room.
All right, management again, we want to thank you, Mr. Backboard, and the rest of the staff. Thank you, Mrs. Collins, Mrs. Pearson, Marion, everybody else. Thank you as we continue to uphold what Jahmale is meant to be.
Yeah. All right, let's go in.
So this is our holding room.
Oh.
Where our patient can relax in the automatic bed until the time comes to be diagnosed or whatever.
Or that.
The The nurse is gonna be here, there will be a nurse here, there is a nurse here at all times to monitor our patient and keep an eye on our patient. We have our beds, we have our BP monitors, we have our stethoscope, our otoscope, we have gloves on the wall, we have our hand sanitizer, and the phone is right a second they see our nurses sit there.
You said they said the nicest here at all times. Where you came from?
Because they didn't want them to come in while.
Before.
Yeah, before we open it.
That's just
So this is our air-conditioned, multi-purpose holding room.
How long do you keep one here before going for the actual?
Well, it all depends. Say the holding room, we don't have, this is not an in-house hospital, but we stabilize patients. We have short stay. So if a patient came in with vomiting and diarrhea, you know they are losing electrolytes.
Yeah.
So we have to infuse them. So we bring them into the room, hang a fluid, and stabilize that patient. So it may be the fluid might take 45 to an hour to drip or whatever.
Now let's talk about charge a little bit. No matter what it is, you still know it is far better than riding a plane to go to South Africa,
Sure it
paying
is.
for hotel bills, and taking risks. What does it look like for somebody to come here before getting to?
There's no charge to be kept in the holding
Oh,
room.
no charge.
No.
Then I'd like to be here.
Come.
We're gonna hold it for a reason now. Not just a visit.
Not just to come, looking for a reason, yeah.
So we just want to make our patients comfortable until they are ready for their test. So when you do your test, if the ambulance is not here or the person who bring you is not available, we bring you and keep you comfortable. If you are very sick, too ill to be transferred to in-house facility, we keep you here, our doctor will come, will monitor you, will stabilize you before you are transferred.
Okay,
This is the purpose of
thank you. I was promoting this entity once on my program at ELBC.
Oh, yeah.
And somebody said, but they don't do treatment there like a normal hospital. They only do diagnosis. They do tests and transfer you. How true is that?
That's not true.
Ah.
We do the basic. We do treatment. We do IVs, fluids. We do Foley catheterization. We do wound dressing change.
So it's a full hospital.
No.
It's not a full-
What it
we don't
is-
keep patient, but we just do emergency first aid.
Okay.
We give first aid treatment to our patients before they are transferred to Rare Hospital.
So meaning like you cannot do.
It is not
clinical.
an
We do
inpatient
clinical.
hospital.
We do IV fluids.
You can't sleep, that's all.
You can't
Oh,
sleep,
okay.
but we stabilize it before you are transferred. Say you came here, your blood pressure is 200 or over 200. We're not going to send you, even though the doctor refers you to a hospital, but we can't send you like that because it's dangerously high. So we have to stabilize it. Well, this is the room, we bring you in, we hang fluids, we give you stat medication. When the pressure comes down, then you can go to the hospital.
I know Jahmale is not expensive. I have done 2 medical checkups here,
Okay?
especially in Newport. The
Okay.
only time I came here was when I came to do my imaging.
Okay.
People say the place is expensive. Please tell them, you know.
I would
here-
like to answer that.
Yes.
Okay.
Before we started setting charges, there's a survey done within the entire region
Okay.
as to see what was comparable with the different services.
Yes.
And we are the lowest in the region.
Well, I know.
So you know, it is what it is.
Yeah.
And in order to keep anything going at this standard, nothing is free.
No.
It is not expensive. It is what the cost of medical bills are. And so, you know, you check the region, Sierra Leone, Ghana, Gambia, whatever. We have to do all that to find the costing of, because when you do things like this, you have to find out what are the comparable costs,
Yeah.
cost of things, prices, I mean. And so, you know, it's relative when you say, well, it's about your health.
Yeah.
So you think it's too expensive for your health? Well,
It's
nothing
some-
about the choice of getting on a plane, going out of here,
Yeah.
and doing all
Taking
this.
somebody with
So,
you.
so it's all about that.
Yeah.
But we don't think it's expensive.
We don't think so. Somebody even said if you think education is expensive, try ignorance.
That's the same
Exactly.
difference.
Well, what do you have to say finally now to the public? Those who I'll start with you, then we'll come to the chairman of the board.
Well, I'd like to say that this is Jahmale, and we are working hard and very hard to promote this place. In the future, we're gonna go full blast, where we're gonna have an in-house hospital, and Jahmale is going to remain second to none.
second to that. I'd like to hear that. Mr. Chairman, your final comments?
Well, Mrs. Collins has said it, but it is our plan. You know, the whole concept of Jahmale was started because this is how you even start anything. Anybody is sick, they have to be diagnosed first.
Yes.
And that's how we needed a first-class diagnostic center, because you cannot treat anybody if you don't know what's wrong with them.
No.
And so you have a first-class center here to come and find out what is wrong with you, and then we treat you.
Yeah.
And like Mrs. Collins said, hopefully in the future, shortly, we should be expanding to an inpatient facility.
I'd like to hear that.
So that's where we are. We encourage all Liberians, come.
Yeah.
What it is being afraid of the unknown.
Okay.
They sit out there, they see the building, and they think, oh no, I can't go in there. It must be expensive. Well, come and try and see.
Come and try and see.
Come and try and see. You are a witness.
I'm a witness.
Thank
Yeah.
you.
Well,
And
thank
so
you very
come.
much. We have been here at the Jahmale Medical Solutions. Do you want to, Mr. Marlborough, say something briefly?
Please do.
Yes,
Okay.
I would like to say special thank you to the chairman of the board and members of the Jahmale board for their continuous support. There's never a time that we're in need of anything that the board has not come, not necessarily to the aid of management, but to the aid of the public, because it is a health center.
Yeah.
So where we see there's a need, and we need to fill in the gap, all these new equipments and stuff, and as we go along, we try to make, every year we must introduce something new. Now with our expansion project, you can rest assured that by the time it's completed, Jahmale again will be the center in West Africa, not just the Republic of Liberia. So we'd like to thank our board chairman again for his vision, his insight, and his commitment to the health sector in this country.
Okay.
So thank you, Mr. Chairman.
Thank you.
Thank you, Mr. Abbott.
All right, no much talking again. What I say, man, thanks to you, Mr. Chairman, Mr. Marlborough, for inviting us here. Thank you.
Thank you. Thank you.
Can we do group picture, sir?
But,